Thank you very much, Master of Ceremonies, Custos, Dr. Campbell, executives, representatives of DBJ, Medical Associates team, members of the media, ladies and gentlemen. I'm going to give you three numbers: 62, 72, and 80. 62, 72, and 80. They're all linked together. They're interdependent and they are specific to Jamaica. 62, 72, 80. Would like to take a guess on that relationship. Sorry? 62 is independence? Yeah. That's a fact, but that's not the link. Okay. Anyone else? Let me spare you. 72 is the average life expectancy of a Jamaican. 62 is the average healthy life expectancy of a Jamaican. That means the average Jamaican can expect to live 10 years in an unhealthy state. 10 years. And 80 is the incidence of non-communicable diseases, behavioral diseases in Jamaica. 80%. Not murders, not stabbings, not wounds. 80%. That is the link between 62, 72, and 80. These three numbers define the current state of healthcare in Jamaica. They are not statistics we should be proud of. They are statistics that we have to improve because they affect the quantity, quality of human life in Jamaica. I didn't mean to start off depressing you, but I want to share the linkage. When I was asked about the word innovative, to change healthcare in Jamaica requires two levels of behavior. In fact, I was having an earlier discussion with Doc. One is at the governmental level, where we need to have appropriate taxes and appropriate subsidies on activities that promote healthy lifestyle. So you tax unhealthy lifestyle and you subsidize a healthy lifestyle. But that is very weak in Jamaica. So that's at the government level. At the individual level, we need to engage in changing our lifestyles or behavior because 80% non-communicable means it's our lifestyle apart from genetics. So we're looking at the top and we're looking at the community level of individuals. But where am I going with this? The link between the policy at the government level and behavior at the individual level, that link is a primary physician. That link, all of these primary physicians that are scattered around Jamaica, that's a link. That's a link to improving those numbers. So even though I'm the chairman of a hospital is the last place you should be for improving those numbers. The journey of improvement starts with that what we call a PCP, primary care physician, for which we have many in Jamaica. And unfortunately, our society, both at the government level and at the individual level, does not truly understand the significance of that link. We understand the significance of airbags in a car. We understand the significance of seatbelts in a car. And we do it automatically. But we do not understand the significance of primary care physicians. And that is why today I'm very pleased to be here, because this device is within a community. Now, I would like to correct the MC, if I may. She mentioned that we were in country, but where I come from, this is not country, right? I was born in a very rural area in Trinidad, but I've been living in Jamaica, 28 years now. And for me, country is deep country, right? No running water, no lights. You struggle, you walk to school barefoot. Those are the experiences that we have had. But we need to do more of these type of activities, because what we do not see, so apart from appreciating the primary care physician, right, in this case Dr. Campbell, being the link to behavior modification, the other part is we need to do more of this, because as I always say, and because I've traveled extensively through Jamaica, Kingston is not Jamaica. Unfortunately, many of our policymakers don't understand this. And so we need to have these type of innovative devices partnered with primary care physicians that have roots in the community, because trust can only work with someone that has roots in a community, to help us to detect early diagnosis and deal with what this number of 80. Because we need to reduce this gap. We cannot have the average Jamaican spending 10 years between healthy life expectancy and then dying. Think about the productivity, think about the human loss. And we are behind as a country. We are very behind. If you want to aspire to where that gap, where those numbers are far better, you can look to places like Japan, the Netherlands. Okay. So I wanted to paint this picture to show. You may think that you are attending a simple ceremony of a handover of a very simple device to a primary care physician, but you are not. You're witnessing a ceremony to encourage behavior modification. You're witnessing a ceremony of someone who's trusted in the community to help improve these numbers. So ladies and gentlemen, thank you very much for your attention. All right, and I'm happy to be not in country.